So we'll go ahead and start off. I'm going to be a strict timekeeper today, so we'll go ahead and get started with some reflections from each of our panelists, and we'll go ahead and start with Judge Pokorny and then work our way down the table. What we'd really like to reflect on for this first part is what you see from your perspective in the system as the most pressing challenge and opportunity for improving the system response and outcomes for those with behavioral health conditions in the criminal justice system. So from your perspective, what are the most pressing challenges and opportunities?
I find that with all the services that we have been able to provide for people through behavioral health court, there is a certain population of the severely, persistently mentally ill that I don't think will ever be able to function, say, in their own apartment with services, going to Bert, Nash, going to therapy and treatment, that they're going to need a more structured environment. And I don't mean the old lockdown state hospital type of environment. The environment that comes to my mind is Bridges that Bert Nash has, and it's 4 women and 4 men, is that correct, who all live together in group living, have their own bedroom, community kitchen, but there's all day long there are classes and support systems, and then there are systems to make sure that everybody is taking the medication that has been prescribed, that they're eating well, that they're exercising, that they understand the bus system, or if they need transportation to get places, there's somebody that can help them make that telephone call to Medicaid transport. Just a little help to stay on track and have good quality life. And I see that as really the biggest challenge with my direct involvement with people in behavioral health court. And I don't know how, money solves lots of things, but that is and Nicole can address that, but that I believe is a very expensive program because there's somebody living there 24/7, not just one person, several people, and then all the programs and assistance that's provided. But it allows a person to have good quality of life while managing their behavioral health. So.
We still have a number of people in our community that are underinsured. So I think as a community, as a state, we always have to address that there's so much more that we would like to be able to do, but the number of people in our population who don't have the insurance, the adequate insurance, the adequate support to get a full comprehensive support and treatment for mental illness is a significant gap that we're seeing. So in addition to that, I would say we also try to build up a network of social supports, community supports. The more we connect and network, it also shows gaps. I mean, it shows where there are still areas where people can fall through, or and we can have safety nets in place for them. But building up a really broad community-based social supports, family networking supports, and building up just financially giving people adequate insurance to meet all of their needs will be an ongoing effort.
Thank you.
Thank you. From my perspective, I would see the timely access to the state facilities for the times that we have to involuntarily commit somebody, and they end up staying at the hospital for sometimes upwards of a week, sometimes even further in the emergency department. And I think that timely access to those facilities is one of the most pressing challenges that I see from my perspective. And also the transportation to said facility is always going to be an issue, whether it be by private company or a peer, however we get those people to whatever facility that they're going to, oftentimes that becomes a challenge from my perspective.
Try not to knock anything off there. Well, you know, the pressing challenges, I think, are also our opportunities. One of the things that has really struck me over the last several years, and if you've been around doing any of this work for the last 20 plus years, has been our capacity in the system. We started in the 90s, state legislatures started defunding the state hospital, moving things back to locals for mental health care and treatment. Most communities weren't prepared for that. And one of the problems with not being prepared for that is we started directing people with mental health issues and challenges to our ERs and our jails, because they're the only places we had for emergency services. And so, fortunately, in Douglas County, we have our community mental health services and providers, but like most other places, we weren't fully prepared for the slow avalanche that became eventually an onslaught of these issues in our community, and now we're trying to deal with them and try to deal with them quickly. So I think one of the biggest challenges for us is building our capacity to be able to take care of these types of situations, address the needs here in our community, but that, as we've seen recently, it's probably also our biggest opportunity, because we can also tailor our capacity to our needs specifically here in our community. So I think this is probably the biggest thing for us, is building our capacity over time to meet the needs of our community.
I would agree with all the things that have been said by the panel so far, but I want to piggyback on what District Attorney Branson just said. I think there's tremendous opportunity for us now that we have made significant strides in the criminal justice system, and we have a much better understanding of what's driving those successes. We have a challenge and an opportunity now, which is, what do we do with the folks who are living in our community before they engage with the criminal justice system? And the real opportunity that we have, I think, you know, if you look at the community health plan that was adopted, we said we were going to focus on 3 areas. Number 1, prioritizing prevention. So what can we do with our young people and folks who are in their 20s, who are starting to exhibit signs and onset of serious mental illness before their living situation declines to the point where they are sort of desperate and they start to lose options and they wind up in the criminal justice system? How can we intervene earlier in our school system? We've just sort of expanded the RAP program, which is a program that integrates behavioral health specialists in our school districts, in the middle school and high school. I really feel like the opportunities are to take a look at where we are upstream and what types of interventions and programs can we put in place from a prevention standpoint and from an early intervention standpoint, because as somebody who has experienced that onset of serious mental illness in my 20s, I know that if you, with good treatment, good services, and ongoing support from your community, you can have a life that is full and rich, and we ought to be able to be putting those pieces in place so that everybody in our community can experience that regardless of what their health condition is.
So Judge Pokorny, we're going to come back to you. And I think as folks saw through some of these comments, talking a little bit about partnerships and holistic approaches, would love for you to just talk a little bit more about the challenges of a multidisciplinary team working together to meet the needs for clients in the behavioral health court. And what does that look like? What are the challenges? What's worked really well in terms of that multidisciplinary approach?
To me, challenges, when you're asked that, it always now has that negative connotation that, as Mr. Branson then said, but these challenges are simply opportunities to do, you know, whatever it is we want to do. When I thought about this question, the reality is there have not been challenges with a multidisciplinary team. It has, as far as I'm concerned, run so smoothly. And it's because all of us know that in our little area of expertise, it is a little area of expertise. And everybody else has another area of expertise, and they have different life experiences and different thoughts on what can work, what won't work. And everybody who has volunteered in one way or another to be a part of the behavioral health court team is there because they want to be there. And they are there because they think they have something valuable to bring to that team. And everybody on the team respects everybody else. Everybody on the team listens to everybody who wants to make a comment on an issue, and not everybody on the team thinks they need to comment on an issue. And because we all have one goal in mind, and that is the higher good for the behavioral health people who are participating in the court, we have never had an argument. We've had some good discussions. We've gone back and forth on what to do, but I would say 99.9% of the time we have all come to a mutual consensus on what the next step should be, and then we have gone on, and the 0.01% who maybe didn't agree knows that in the long run their voice was still heard and we understood what they were saying, and maybe the next time we'll realize they were right. So I cannot impress upon all of you how well that multidisciplinary team works. And most teams should have such a variety of people on it in order to come to what I think is the best outcome.
Well, keeping in theme with strong partnerships and sort of working across agencies and systems, Nicole, I'm wondering if you can talk a little bit about your approach regarding engaging law enforcement as well as other community partners, and how did you determine that partnership was important for better outcomes, and how have you approached that partnership?
Sure. The word that comes to mind to me is relational. It really is about relationships, and what we found is, they start years before you're in an operational phase of being able to put something into place. So our partnership, that Bert Nash has held with law enforcement, with the district attorney's office, with LMH, Lawrence Memorial Hospital, began years ago. And what we really focused on is how do you build those relationships in the sense of getting to know the partners in those agencies, getting to know those systems. As Judge Pokorny was saying, we have our area of expertise, we have our specialty in mental health, but we quickly realized that for us to meet the needs of our clients, we have to know the lifespan and the things that they are involved in. So if they're involved in the criminal justice system with law enforcement, what does that look like? And how does that system interplay with their life? So we really worked hard to build relationships, get to know partners in each of those agencies, and also to learn their systems. So not only to learn their systems, but to learn the liberties that they have within there as well as the limitations, and how do we intersect with each of those. And that leads us to the problem solving. So, and that helps us to be able to target the areas that we need. We can individualize that care for people as they come through our doors. And beyond, and that relationships helps you to be able to call your that law enforcement partnership and say, hey, here's what I have, or to call the district attorney's office and say, here's what we have going on, and we can collectively try to collaborate how to meet the needs of that individual person. And then that bleeds into the broader system of care. So we are continually learning how our systems intersect, and as we grow and face those challenges, how do we work within those systems? How do we help those? As a mental health system, how do we bring that to other systems that we interface with as well? But key part is relationships. You have to start early, building those within your community. So when you're at a point where you're ready to operationalize, you have that capability of moving forward.
I think it's important to underscore some of the points you made about when working with another agency or organization or system that you're having discussions about what are the strengths, what are their perspectives, and what are their real limitations, so that there's a real understanding of maybe why certain things are one way, and it helps with that problem solving when you're able to get to that. So I think that's a really important point. Sergeant Halsted, to continue the theme. If you could also, from law enforcement's perspective, talk about those partnerships and, you know, those different partnerships that have really allowed your officers to sort of better serve people with behavioral health conditions, and what that has looked like, and the importance of that, and how you've built those and come to the table.
Yeah, the relationships that we have in law enforcement, especially with Bert Nash, is key. And it's a kind of a two-tiered approach in the sense of training for our officers, both with the mental health first aid training when they're first into the academy and they go through that, to our increased and ongoing CIT training for our officers, which is our 40-hour course throughout the year. And one of our key partners obviously has been Bert Nash and Nicole in particular, to help drive that forward. But that relationship doesn't start and stop with Bert Nash. That relationship building goes on with Lawrence Memorial Hospital, with DECA, with Heartland, with headquarters, with all our Willow, with all our different partner agencies in the community, to try to get that consumer some type of connection, because that's what we're trying to do, right? And if they have a connection with us, if they have a time where we're called out for all the way from somebody that's suicidal to the point where somebody is just acting strange, which we run the gamut there, we can hopefully try to get that person some sort of connection, whether it be immediate or whether it be in a next day or 2 days or 3 days, but in some sort of a fashion connect them with one of those agencies that kind of can try to help them. With the mental health team that we formed at the police department, that retired Chief Khatib helped form, and Chief Burns has obviously continued forward, that follow-up and that connection that we can get those consumers has really paid dividends on getting people into different services to help with whatever issues that they have need help with. So that relationship that we have, starting with Bert Nash and moving out and radiating out, is helped our department help our citizens, and that's really what the bottom line of it is.
District Attorney Branson, I'm wondering if you can also talk about the importance of multi-agency collaboration in Douglas County. I think in particular the Criminal Justice Coordinating Committee, which not all counties have this planning group. It's really fantastic that Douglas County has that and is able to sort of pull those folks together for this strategic planning and continued look at different strategies to move the systems forward. Wondering if you can talk a little bit about how that has worked to build that collaboration, what strategies have really been effective, and sort of what the outcomes of that have been.
Collaboration between agencies is absolutely essential. We wouldn't be able to do any of the things that we're doing now without that collaboration. And frankly, the CJCC has probably been one of the biggest drivers and factors in that collaboration, because it's really being able to bring us all together at kind of the big table to be able to have the discussions, talk about, as the judge said earlier, our little tiny areas of expertise and match those up with everybody else's. So we have an opportunity to see, I'll use this word again, what our capacity is, where we're lacking in things, and how we kind of stretch and meet those divides. Really, the CJCC was an opportunity for us to identify our common goals and really identify those resources out there and start talking more about the problems that we're having and the things that we really want to address. We've had really good partnerships with everybody involved with the CJCC, bringing information to the table, bringing their data to the table, bringing their lack of data sometimes to the table has been really, really important for us, because then we start seeing, hey, we don't know how to count this, or we've never counted this before. Why is it important to count it now? Or what is important for us to count? those discussions have been huge for us because we spent several sessions and meetings having frank discussions on why is it we're counting this number in the first place. And so some of those discussions and getting understanding as to why those things are occurring was really very important for us. And the CJCC did a lot to make those things happen. So I think it's a pretty simple thing for us, that the collaboration, we don't get anywhere without that collaboration between each one of the agencies. You have to check your pride at the door if you brought any with you at these meetings, and you have to be really kind of willing to roll up your sleeves and get down into it. And to say that before you have the collaboration, you really have to have the willingness on the part of your electeds and your appointed leaders, because if you don't have the willingness across the board, which fortunately in Douglas County we do, you're not going to get anywhere. And so having that willingness and the ability to come together and do those types of things is really important. And I think the results of that, you've seen them here today. Reducing our jail population of people with mental health needs down to 8% is amazing. And I don't think people realize how big of a change that is to going from 17 to 8. It may not seem like a lot of numbers, and it may not seem like a lot of people, but the impact it's made on those folks is tremendous. So the collaboration, we just wouldn't simply be able to be here without that.
Great. Bob, I'm actually going to turn to you, follow up a little bit on what the DA was saying about data, and how the county actually prioritizes which systems improvements and programs are really worth pursuing. How does data play a role in that decision-making process, as well as in the strategic planning through the CJCC and then the other groups that you're involved in as well?
So I think that we have learned a lot by paying attention to how the criminal justice system and the correctional facility have made advances on gathering data and analyzing that data. And on the behavioral health side in the community, I think the health department has really taken the lead saying, how do we sort of have that same robust approach to gathering data that's going to inform our decisions about how we address issues of substance abuse and addiction? What can we do to get better results in making sure that people don't come back to the emergency room, just like we don't want people to come back to the jail? And so I think what's really great about what we've learned by having the outside assistance of the Stepping Up initiative and sort of guiding us through technical assistance of how do we drill down into these numbers so we know what they mean and how do we identify what we're looking for. Here's the challenge now. Can we take what we're doing, again, in the community with the behavioral health work and combine it with the criminal justice work and sort of start to say, what can we understand about our system of care holistically, right? A system of care is a little different than the idea of a continuum of services. System of care has a number of touch points on it. Our jail is a touch point on the system of care. Our emergency department is a touch point on the system of care. Our Lawrence Community Shelter is a touch point on the system of care. So how do we start looking at this system holistically and kind of get outside of the silos of criminal justice and behavioral health? What can we learn about sort of, our community? And we are doing that, I think, in an approach to addressing some of the pieces of having folks arrive in the emergency department, which is not an ideal place for somebody in the midst of a behavioral health crisis. So we've kind of built on this idea of having an integrated multidisciplinary team that is embedded in the emergency department and supported by a peer-driven project to make sure that when people are identified with a substance abuse issue, if they're ready and willing to go to detox, which is the first step in that recovery process, we are making that possible, and we remove barriers for access, as Nicole was saying about insurance and all of these things that keep people from getting involved. We're doing the same thing with providing everybody who is willing to engage in care coordination after a crisis in the emergency department, to do a warm handshake, not just a handoff, and walk with them for 30, 60, 90 days. So I think we need to continue to learn from each other, and the way to do that, and I think this is really kind of the role that the county can play, is to continue to convene those conversations, shape those councils and the coalitions and the work groups, so that, you know, by design, we're working together and making the best use of financial resources, because the investment's significant.
And Bob, another question for you. In thinking about all the things that are in place that you were mentioning, and the good work in moving forward, one of the things that I think we've come across in our work in other jurisdictions is the, I'll say, both challenge and opportunity of leadership turnover in some cases, and how that can affect current planning, current strategies, and future planning as well. I'm wondering if you have any thoughts on just strategies that Douglas County in particular has in place to continue partnerships, even if there is leadership turnover, and you know, how you really have formalized those partnerships to sort of safeguard against some of that, or embrace it in times where maybe that is helpful to the bottom line.
So, you know, it's interesting. I was thinking about this question last night, as if it's sort of like we want to make sure that we're durable enough to sustain leadership turnover. If you look at what has happened in this community in terms of leadership turnover in the last 5 years, there's been tremendous turnover. Our county administrator has turned over. We have an interim county administrator. We've had 2 county commissioners that have been replaced. We've had new people come into new positions that haven't even existed with the county. The CEO at the hospital has turned over. The CEO at Bert Nash has turned over. The CEO at our FQHC. So I would argue that we actually are experiencing and have experienced all of the possible sort of turbulence that you can experience with leadership turnover. And I think the commitment to the mission that we are going to be the right type of community to support people who are struggling with chronic health conditions or serious challenges, that is a common purpose that we have. And if we keep reminding ourselves of that, and pointing to the progress that we're making in addition to the challenges that we face, I don't know. I would submit that what we've experienced in the last 5 years, the progress that we've made in the face of the leadership turnover that's happened, I'd submit there's some more learning to be done here, and asking ourselves, what are we doing right? Because I think we've weathered that transition really, really well. And I think it also speaks to, because you can look at outgoing leadership and new leadership and say, oh, well, the new leadership, they've just got better ideas or new ideas. I think that would be a huge mistake, because what's happened is outgoing leadership has created a foundation upon which we've built, and we're modifying and we're tweaking and we're adjusting. But I don't know. I think that's one of the things we should be really proud of. We've weathered that turnover pretty well.
Judge Pokorny, question for you. From your perspective, what does success look like for someone who has a mental illness or serious mental illness and is engaged in the criminal justice system? What sort of outcome do you hope to see, and what success looks like?
I don't think there's a one success fits all for the people that go through behavioral health court, because they all come to us in such very different stages. We have the severely mentally ill, and then we have the severely persistently mentally ill. And so what can be success for a severely mentally ill can be, I'm back home, I'm with my family, I'm engaging, I have employment now, and I have insurance, and I'm still attending my therapy regularly. I have support systems in place that I can rely on, but that it really does look like they've just have picked up, but kind of my description is just a good, normal, middle-class life. Working, participating with family and community, and the most people who had never known them before would absolutely have no idea that they had had any sort of crisis intervention from mental health or the courts. There are other people that success is going to look much different, but they're not in jail. They're in the community, but they, in the community maybe that they're going to be in and out of the homeless shelter, couch surfing still, but that they know where they can go to receive assistance and are willing to rely on that, and they're staying out of the criminal justice system and not back in jail. So there's like I said, there can be a huge continuum in that population, but I think what we regard success is that they aren't in jail, they are not in the emergency department 3 times a week, they are not having to have involuntary commitments at the state hospital, because we hope that we have convinced them that there are people who care about them in this community, there are services that are available, and they have learned how to access those services.
Nicole, is there anything that you would add to that in terms of success and from your perspective, what that means for folks involved in the justice system?
Not much. I think she wrapped it up very well. I do think that success, when people come, whatever path brings them to behavioral health court or some other form of criminal justice system, and they have a mental illness, we realize that, that mental illness is something that they carry and they're trying to navigate through all scopes of their life. So similar to health conditions, physical health conditions, it doesn't go away when you are incarcerated or if you find yourself in court, if you find yourself homeless. So success also looks like when a person is better at navigating their life, managing their mental illness. So as the judge said, it doesn't mean everything is perfect and they may still be in and out of certain types of services, but what we look for is progress. We look for a person's ability to think differently in the sense of maybe they're considering things now that they wouldn't have considered 6 months ago when they're making their decision. So really practical successes where people learn how to manage their life, they learn how to navigate systems, they are making progress toward reaching their goals, and they have better supports around them, is some of the ways our clients will describe their success as well. So that's what I would add.
Great, thank you. From everyone's perspective, where you all sit, what resources do you need to really sustain and enhance these cross-systems collaboration efforts from each of your perspectives? And that can include data collection and analysis or other things that you would really like to see and would need more resources to do so.
Well, I think the systems are in place for data collection. So the issue is going to be, to me, interpreting that data, but I think we have those systems in place once we get enough data to actually look at and interpret. I go back to, once again, money. I still think that expanding group living in this community for people who will have persistent lifetime challenges to deal with, who need some extra assistance, would be invaluable. Just because there's assistance given, but in some ways, sometimes I feel like we just jettison these people. It's like, okay, your time's up. You have met the markers that we've said you need to make. Now you're out of behavioral health court, and then we see them in a month, and they've lost that hand-holding, and some people just forever will need that warm handshake. Is that how it was described? And they'll need that warm handshake for the rest of their lives, and I would hope that we, once again, could provide that in the least restrictive environment so that people can still be successful with a little bit of help.
And same question down the line. Yep. And what sort of resources would you need to kind of sustain and enhance any efforts that you would like to see in place?
Well, because everyone will probably say money. That's always an issue, say money. Ryan's going to talk about money. I think about our younger generations, children. There's a lot of efforts that are happening for kids right now, particularly in the schools. But when I think about community broad services and how can we enhance and wrap around support for a person, so when as an individual, I can go to, in addition to Bert Nash, I know I have support. If I'm arrested, I know I can have support through all the CIT training and the efforts. To go to Douglas County Jail in this community can be a supportive intervention for a number of people, and it doesn't look like that in every county. So I would like to see where else in the community can we build this type of network. Our churches, our different broad spectrums of systems where as we as professional agencies have collaborated and built systems of care and built safety nets, how can we extend that and see some of those types of dynamics in the community broad? Because what we still find is that the first responder truly is that friend, that neighbor, that community. And as we treat and try to provide mental illness services for people with mental illness, we are still trying to build up those networks because we realize that the best way to really help someone enhance their life is to build what we call their natural supports, and to build a number of things that, years down the road, they will still have that are still reliable. So I would say as a community, how can we take this effort and really build up a system of care? Not saying it's not there now, but how can we make it more visible? How can we have more momentum? And how can we partner it with agencies that are represented here so people can feel that type of dynamic in their own natural systems as well?
I was going to talk about money, but no, I'm not going to talk about money. First of all, I just want to thank all the leaders here, both elected and non-elected and appointed. Thank you for listening. Thank you for hearing the successes. Thank you for hearing the challenges. Thank you for that thoughtful discourse that we have. There's not been that long ago that maybe wasn't quite as done quite as well. But thank you for that. And I think really, especially with it being poignant to me, with it being Law Enforcement Appreciation Week, I think the support of the community, the support of our elected officials, the support of our appointed officials is what we need to do to grow all of our programs, whether it be with Bert and Nash, whether it be with Behavioral Health Center, whether it be with Lawrence Memorial Hospital and the ICT team and the CJCC. We just need that support, and we just need that dialogue, that thoughtful dialogue to happen so that we can implement some of these programs, these evidence-based programs that we're seeing work, and try to reduce some of these jail population, ER visits, and throughout the gamut. I think that's really what it comes down to me. Not necessarily money, it just comes down to support.
Same question.
Yes, please.
So, okay, I'm going to change the question up a little bit because that's what electeds do sometimes. The question is what resources, but I'd really like to talk a little bit more about goals, if you would. Patience and determination. We have to have patience as a community, and we have to have the determination to see these things through, because it is going to take money, It's going to take time, and it's going to take a lot of effort and a lot of collaboration, which we've thrown that word around a lot today. Some of the nuts and bolts of things that we really need, we do need robust data collection. We've gotten a lot better at that. We're not anywhere where we need to be yet, in my opinion, though, because we're not able to share that data all the time across platforms, across agencies, and share it in a meaningful way to make sense to all of us. The other thing I think we really need to do as a community is develop meaningful aftercare solutions that are not supervised or ordered by the court. Our goal, hopefully at the end of all this, is to get the court out of the process, and we have to start looking at how we develop those things outside the legal system, because after all, the legal system isn't where we want this stuff at. And then I think finally, one thing that I think has been lost in a lot of the discussions we've had over the last several years, that's a resource but also a goal, is to develop and continue to look at preventative services. We're dealing a lot right now with what do we do after somebody's in the system, but we haven't been talking the last couple of years about how we keep people from coming into the system. And we really have to start looking at that part of the conversation too, whether it's support for RAP workers, to give kids support and everything they need while they're in school, suffering crisis, whatever it ends up being, whether it's developing restorative justice, things in our community that are outside the legal system. We need to try to work on the preventative services in our community to really bring this thing full circle and get the changes that we want to see happen.
Bob, you get the last word.
So I'm going to do a variation on the theme on money. When we started it, we were in a political process about a year ago, and one of the people in the audience said, what could you do if you had $40 million that you were putting into the behavioral health system instead of putting $40 million into the jail? And my response was, we don't need $40 million to put into the behavioral health system, and there was this in the audience. We need $40 million, or we need money to be invested in housing. Housing, safe, secure, stable housing is what we need in this community. That's expensive. So we need to take a look at some of the interventions that we're doing and ask ourselves, how could we manage some of these programs a little bit more efficiently or effectively so that we can direct resources towards what needs to be a priority, housing. And we also need to find some ways to bring some more dollars, I think, into the community through the type of work, collaborative work we've been doing with SAMHSA, with the Council of State Governments, this type of initiative, because I think if we do it right, we're building what could continue to be a model. So we're going to build a recovery campus, not just a crisis center. The recovery campus is going to have crisis services and care, but it's also going to have respite care, transitional housing, permanent supportive housing. Does that solve the problem in the community? No, but it's a model of the type of system we ought to be building, and we have to keep pushing ourselves to say, I was thinking, I've gained about 20 pounds since I started this job, and I could use some intervention in an exercise way. Well, if I go into my basement, I have a Nordic Track ab flex. I used to have a solo flex. I have a stationary bike, right? We could say we have behavioral health court, we have an ICT team, but if we're not actually using those tools, we're not going to be any healthier as a community. And so that process of continuing the conversation and being courageous enough to look and say, we have this, but are we getting the outcomes that we need? We have this, but we don't have housing. We need to focus on housing. I think building on the relationships that we have so far and starting to ask ourselves, now that there's trust and there's communication and there's collaboration, okay, how do we really push ourselves to get the get the right results. And I'm very excited about the potential that we have around this table, around the coalition's table, and the conversations that go on every week, time and time and time again. The leadership here and our frontline folks that are doing this work are spending a tremendous amount of really valuable time talking to each other and saying, how do we make this community better?
Well, I have some closing comments, and then I know Robert's going to come up, but if you all could join me in thanking our panelists. I think some of the things we heard, really important themes for today. Our panelists really spoke about prioritizing strong partnerships across agencies and systems and areas of expertise. Definitely the theme of collaboration and convening in work groups and how important those are. And I'll just say on a personal note for the work that we do around the country, without having those foundations in place with all of you all and the CJCC and the Stepping Up work group and the other work groups that are going on, sustainability in these continued conversations are really difficult. And I think I'm hoping Risa will nod at me as I say this in affirmation, but one of the things that we see when we work in other jurisdictions is that without those, sustainability just doesn't happen and things don't move. And so I think having those things in place, you all should be really proud of that as that foundation that can really help sustain all the great work and planning that you all have been doing. We also talked a lot about flexibility in thinking through what success means, data for decision making, and in particular what I really liked was working towards that common North Star is really a unifying factor in your cross-systems partnerships and how important it is to have that, in particular through leadership changes as we were discussing. I think also what's important to note is that there's a lot of really good work being done, and there's an opportunity to really harness that momentum to start tackling some other challenges and opportunities that folks have been talking about, such as transportation, access to services, building capacity, some of those gaps in insurance and gaps in care, and of course the data collection and thinking through what you need for analysis capacity and really being outcome driven. And so there's this opportunity to really build on the work that you all have been doing and continue that forward momentum. And I know you all are very much up to the challenge of doing that. I want to thank you all for being here today, in particular our panelists. I know that it's a lot to sort of ask of your time. We really appreciate it and hope you all found it as worthwhile as we did. I know Robert's going to come up and make some closing comments, but if you all could join me one last time in thanking our panelists for a great presentation. Thank you.
Katie, good job, Katie. Thank you. So we have run over, so I'll be brief, but you know, this is adaptive work, adaptive challenge, and it's progress. We're talking about progress that where we're at today. So more to come. Of the 2 million people that are incarcerated with mental illness in jail every year, you know, 8% last year for us, 56% decrease since 2014. Those are good numbers, but also other numbers to be proud of in our community is, you know, the national average for incarceration is 3.3 per 1,000. Across the country. The state average is 3.2, and in Douglas County we're at 1.8. So we don't like 1.8. We want to continue to work and continue to make progress and drive that down. But those are good numbers to leave you with. So thank you for being here today, and thank you for participating in this event.